I now welcome Mr. Stephen Bouwhuis from the Department of Health, Disability and Ageing. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to Senate committees has been provided to you. I remind senators that the Senate has resolved that an officer of a department of the Commonwealth or of a state shall not be asked to give opinions on matters of policy and shall be given reasonable opportunity to refer questions asked of the officer to superior officers or to a minister. This resolution does not preclude questions asking for explanations of policies or factual questions about when and how policies were adopted. For the Hansard record, will you please state your full name and the capacity in which you appear today?
Thank you, Senator, and thank you for the invitation to attend the hearing today. My name is Stephen Bouwhuis. I'm Assistant Secretary of the Environmental Health and Climate Change Branch in the Interim Australian Centre for Disease Control within the Department of Health, Disability and Ageing. We're responsible for providing health advice on key environmental health matters, including emerging issues. We work through the Australian Health Protection Committee's Environmental Health Standing Committee, which we call NHealth for short. Through this forum, we work with the states and territories and other Commonwealth organisations, and that includes providing high-level advice on PFAS and human health. We also contribute to the wider government response to PFAS contamination, which you've heard about from other government witnesses as well. In my opening statement, I thought I'd highlight a couple of aspects of our work which might be of particular interest to the committee, but of course you're welcome to go wherever you like, and I'm here to assist with your questions. There is the NHealth February 2024 updated guidance statement on fact sheets on PFAS, and these incorporate evidence including findings from the ANU's PFAS health study, which you've also heard about during the evidence, and consolidate previous NHealth advice. We also commissioned the National Health and Medical Research Council to review PFAS values in Australian drinking water guidelines, which I know has been discussed in previous hearings of the committee. We also provided funding to the Australian Bureau of Statistics to include PFAS biomarker testing as an indicator in their National Health Measures Survey as part of the Intergenerational Health and Medical Health Study. And these results were released on the 27th of May 2025 and may also be of interest to the committee, and I know a few witnesses have made reference to that this morning. As also made reference to in some of the evidence this morning, we continue to apply a precautionary approach, recommending that exposure is minimised where possible, because PFAS persist for a long time in humans and the environment. We welcome the opportunity to appear today and look forward to responding to questions from the committee. Thank you.
Thank you, Mr. Bouwhuis, and apologies for my pronunciation. Senator Pratt.
Thank you. Can I ask, there are many communities around Australia who are using water sources contaminated by PFAS above current recommended drinking water levels. What are the public policy ramifications of that in terms of advice and support? For example, securing alternative water supplies.
Thank you, Senator. So the monitoring of water supplies would be done generally through the states and territories, although we do discuss with them through NHealth their monitoring programs. So we are aware of at the Commonwealth level the monitoring programs in place. For the most part, those have shown that the water levels are below the proposed guidelines by NHMRC under the existing guidelines and the new proposed ones. There have been a couple of notable examples where they've been shown to be above, and those have been heavily covered in the media, and those have been managed by the relevant water authorities. And they're probably best to explain how they manage those water supplies so that they don't get to the general public, but generally they would isolate those water supplies until they find the source, until they're sure that the drinking water is safe, and if they didn't think it was safe and below those levels, they would isolate it as a general rule. But those exceptions have been pretty well covered in the media, particularly those in New South Wales.
Okay, so I'm thinking in particular of one in Western Australia where someone's personal impact statement to this committee says they use bore water, it's next to a former firefighting facility. They grow vegetables. And that testing has shown elevated levels of PFAS. Is there what should be happening, or does the Commonwealth restrain itself from saying anything because it doesn't want to imply what should be happening because of its relationship with the states?
Thank you for the question, Senator. It's hard to comment on an individual's circumstance, but we can look at particular ones on notice. We would generally work with the states and territories where there are issues, and we do work through NHealth to make sure that there's a common approach between the Commonwealth and the states and territories. So everyone is aware of what the NHMRC guidelines are and the revised guidelines, and they're all working to make sure that the water supply is safe and below those levels. Where there are particular circumstances where they're above, then they'll work to try and ensure other alternative sources of water. So it might be bottled water or something else in a particular case, but it's hard to comment on a particular circumstance without knowing the facts.
Okay. If you could have a look at the facts around Jandakot Airport in Western Australia. So, for example, in November 2022, residents received a letter from Jandakot Airport informing them they detected PFAS in groundwater and instructed people to stop using bore water until testing could be undertaken. Now, there is no scheme water in that location, and they rely on bore water for all their household needs unless they've got sufficient rainwater. And that they had been told after testing that about 20 homes had levels higher than drinking water guidelines, with 6 over the irrigation guidelines. And can I ask, in the context of Wreck Bay, and its somewhat unique jurisdictional status, has the Commonwealth had any involvement in looking at drinking water and water quality there more broadly?
I understand infrastructure monitors that regularly, and they publish the results up on the internet, so you can search the results, but they sample the drinking water on a regular basis. I think it's monthly from memory, and they publish those up on the internet. The last ones I'd seen were below the NHMRC recommended levels for drinking water. But yes, I'm aware that infrastructure monitors the drinking water levels and publishes those on their website.
And what about historically the level of PFAS contamination at Wreck Bay?
So I'm aware that Defence and Infrastructure are working around the issues about Wreck Bay and the historic contamination from PFAS, and are working to remediate that. And I understand you had some evidence from both those agencies earlier in the hearing process.
In the most part, community concern around this issue seems to have been focused around cancer, and the evidence there is still evolving. What consideration's been given to, within an Australian context, of treating all PFAS chemicals as a single substance to be regulated, then with, exemptions from, for when it appears in medications, etc. What's the current approach on those issues?
So a general advice is a precautionary one on PFAS as a whole kind of class. As you've heard from the different witnesses over time, defining it as a class is there's different opinions on how you might define it as a class. We do generally just define it in terms of having a fully fluorinated methyl or methylene carbon part of a molecule, which is obviously a broad definition, covers a wide range of chemicals. Those will have kind of general different properties. So to some extent, you do have to look at a bit of a case-by-case basis. The other would be, as you've heard, the majority of those aren't really used in Australia or used to any extent. If you have a look at the ABS data, you'll see that the highest proportions are from PFOA, PFAS, and it's PHFO, SXA, SXS. And those are the ones found in the highest proportions within the Australian population. So the majority of those chemicals wouldn't really be used in Australia or wouldn't be a statistical significant kind of proportion within the population. So, so it's difficult to treat them all or try and ban them as a class when there's different definitions and they have different properties. And so we do tend to focus on the ones found most common within the population.
And which properties in which parts of that spectrum of chemicals are the ones that impact birth weight, thyroid and sex hormones, immunological function, kidney function, cholesterol, hormones, birth weight, etc.?
So those are generally where associations are found. There's pretty limited evidence for PFAS chemicals causing particular diseases, but there are lots of associations, which you've heard from the other witnesses, and you've listed off a range of them. The two biggest ones which would occur for would be PFOA and PFAS, which are also the ones which are widely kind of found within the Australian population because they've been used historically in commercial applications and also firefighting foams and other things.
Okay, so a lot of the community debates around cancer, and yet, I guess in the example of the case of Wreck Bay, I worry that we're in a situation of compounding disadvantage around, kidney function, birth weight. Is any regard by the Commonwealth agencies like Defence and Infrastructure being given to not just to looking at, the compounding disadvantage there?
Certainly there's a lot of our colleagues at the federal government would have a look at Wreck Bay and the compounding kind of disadvantages to those communities and health. And I know Minister Butler had written to the chair of the committee about cancer and Wreck Bay back in March, I think. So there is a focus on it. I know Defence is also focused on the health effects, and they were doing a health impact statement, which they were kind of recently updating as well. So there is a focus around that from...
And is that just on cancer, or has it really come to grips with the other science around suppressed immune systems, birth weight, etc.?
There's a wide number of health impacts in First Nations communities beyond PFAS to take into account. Certainly that's something the government is aware of.
Yeah, I understand that. And but that PFAS compounds some of those like you acknowledge the association of PFAS with these other health impacts. It almost seemed like, from the evidence this morning, the role of these chemicals in suppressing immune function is even clearer than some of the cancer correlations. So it would seem to me that is certainly a reason to think about going above and beyond what the NHMRC says is an acceptable level of drinking water, given you're also dealing with historical contamination as well as other compounding disadvantage that might also affect, those biological functions in the body.
I think from what I'd seen of the infrastructure data on the drinking levels, they were quite a bit below the NHMRC levels. Okay. And I know Defence and Infrastructure have a remediation program, but I'll leave it to them to talk about the specifics of those.
What does it mean for surveillance in Australia and the need for more science around it? Have you looked at where to from here? For example, very clear, the Australian Academy of health and medical science want to see a human biomonitoring program to track bioaccumulation of PFAS and other chemical contaminants, but in particular the immediate establishment for monitoring pregnant women's levels of PFAS and other chemical contaminants.
There's not currently a biomonitoring program at the Commonwealth level, and that isn't something that's been introduced by successive Australian governments, but we did pay for the ABS to do a study on levels of PFAS in the Australian community generally, and so 7,500 volunteers donated their blood to sample to see what the PFAS levels were like. And so that does give us a baseline population level for population exposure for PFAS, and that's similar to a biomonitoring. And you can see, I mean, it's quite interesting kind of data. You can see over time that the older people get, the more exposure they have, which would suggest that PFAS levels are being reduced, which is kind of consistent with the overseas kind of evidence. They also break it down by different types of PFAS, so you can see the different levels of PFAS in the Australian population, so that's quite...
And did they make any findings about birth weight and other health attributes of those?
I think
so birth weight, I'm imagined, would not have doesn't appear in that data, and yet there's clear reason, according to the scientists that have presented to us today, that pregnant women really need to be monitored.
I couldn't speak to the monitoring for pregnant women specifically, but I do know that ABS data establishes a baseline for PFAS. Whether it would be clinically useful to monitor pregnant women for particular chemicals is not is something I'd have to take on notice.
Yeah, if you could take that on notice, please, because the evidence today says that it should be possible to do that. It wouldn't that there's even a capacity to check for PFAS levels, within the existing samples that are taken, and so pregnant women would routinely get blood tests at different points in their pregnancy, and that even if you were to take a subset of those samples to get a general population picture, as well as another picture from areas where we do know there might be elevated PFAS, that would be an urgent study to undertake. And perhaps you could take a look at those particular submissions to this inquiry in that context.
Thank you, Senator. I'm happy to take that on notice.
What's the direction, aside from cancer, but around those other immune and other biological effects? How are you looking at the scientific research internationally and in Australia on those issues?
Sure. Thank you, Senator. There's a lot of work underway looking at PFAS. So the NHMRC put out about $10 million worth of grants for research into PFAS. Most of that will be getting finalised over the next 12 months, I imagine now. There's an update on their website, but I'm not sure much of that has been published to date, although it is nearing finalisation. We do keep across the general literature, so I think you're talking to a couple of witnesses after me who might comment specifically on the IARC report, which is a big international report which looked at PFAS and PFOA and the correlation with cancer. So that's another one we're across. We also engage kind of experts to assist us in reviewing the evidence. So we have a review currently underway looking at PFAS evidence, and that'll feed into a revised nHealth guidance we would anticipate. So the nHealth guidance was updated most recently in February 2024, but there's a recognition by the nHealth committee of a need to update that further. So we are pulling together analysis of the literature on PFAS and the different studies to inform N-Health ahead of their consideration should there be a need to update the guidance, which that committee has recognised there is a need to do. So we are looking at the evidence, we are looking at the international evidence, we're looking at what other countries are doing, and we'll pull that all together for the N-Health committee to consider in terms of does it need to change or update its guidance, which it has recognised there is a need to do.
Yeah. Have you looked at the Medicare rebates for pathology around PFAS contamination so that we can build up a more accurate picture? That could be done through clinical trials, but equally at some level we'd want in the long term for many different things to see population level surveillance. We could, for example, at some point in the future, if everyone's bloods are in My Health Record, see associations between a locality of PFAS or dismiss an association between it because we've got that population level data. Where is that at?
So there's no general Australian biomonitoring program kind of at the moment that you could kind of add that into, and that would be kind of a question for government to consider whether it want to do such a thing. You would obviously need kind of people's consent to test for PFAS, and so that would be something to be worked in.
We were told today you don't actually need consent to test for PFAS because labs can make samples available for research purposes once the blood's been tested for the purpose for which it was submitted.
I think I would want to make it pretty clear to people if I'm testing for anything in their blood, but I'll defer to the legal people on what sort of form of consent would be required, but I'd be surprised if some form of consent wouldn't be required prior to testing. Certainly I
think most people would be happy to be tested, but I think they might be concerned if they had elevated levels and they weren't told, and that therefore I worry government can have a capacity to hide behind this idea, well, we'd have to get consent for that, when in actual fact I think that misconstrues a lot of public opinion about those issues.
When working through a biomonitoring program, you'd want to presumably consider the ability to go back to people if you found elevated levels. So with the overseas kind of ones, you would generally sample for a range of different chemicals and substances, and then if you found elevated levels, you would presumably want some sort of process to go back to people to say, hey, look, we sampled you and you were pretty much okay for these other things, but we detected a really high level of chemical whatever, and you would want some ability to go back to them. That would be a question to take into account in the design of a biomonitoring program, but presumably that would be one of the considerations to come up, whether you can go back to people, which I would assume that you would want to do as part of a biomonitoring program, but that would be a question for a government should it decide to set one up in the future.
Okay. I think, and some of that will come to light if you can consider the issues around biomonitoring for pregnant women, and really even at this point finding a subset of pregnant women for whom you would test using, as the scientists put to us, the existing blood samples that they give. I'll rotate the call.
Thanks.
Back to
Senator
you, Chair.
Pratt. Mr. Bouwhuis, when would you expect the health guidance to be updated on PFAS?
So I expect in coming months. There's some work underway to do that at the moment. That'll the study we kind of have underway would then flow into that, and that should be due to kind of finish around July, August, and so I would expect the committee to meet after that, and how fast it proceeded would depend on the level of agreement over the different texts, but I would imagine around August, September would be my kind of guess for the updated guidance. But that work is underway, and the committee at its last meeting, which was probably 3 or 4 weeks ago, did discuss the guidance and the need to update it. So that's been agreed, and it's something the committee is working on.
And when was the last time it was updated?
February 2024. But obviously there's a lot of evidence coming out, and there's the IARC report, and there's also the revised NHMRC water levels, so there's quite a bit obviously happening in this space.
Thank you. And I'd just like to follow up on Senator Pratt's questions on Wreck Bay. You mentioned that the Department of Defence was undertaking remediation. When we were there,
Yep.
And since, the community have told us that remediation is only happening at the defence base and not in the community, where the contaminated water is still running through the community. It's still in their water, so they're bathing in it. Are you aware of this?
I'm aware from the previous hearings that there had been evidence about bathing within PFAS contaminated water. I might take on notice the specific evidence, and then I can confer with my defence and infrastructure colleagues and come back to you. But I understood that remediation work was underway, but I had heard from the previous committee hearings that there was statements that people were still bathing in PFAS contaminated water.
Thank you. Can you tell me what your department has done to ensure the community receives adequate health advice services and screening? Because we also heard that they have a doctor once a fortnight. There's quite a number of people that are very concerned about PFAS levels. There's no blood testing because it's so expensive. So there's that, people are heightened, if you like, because they're also burying people with rare cancers, and they've got young people with these rare cancers. So what's the department doing to support this community?
So I understand Mr Butler may have written to you back in March about that allocations around cancer and the services provided to Wreck Bay community. And I can understand the levels of concern within the community. It's something, I understand the health services provided through New South Wales, and that infrastructure and defence work with them closely in the services that are provided. But I might take the specifics of your question on notice if that's okay, Senator.
Yes, I'd appreciate that, because the defence base does not work with the community. The defence base does not provide any update or information to the community. So whilst, the Minister or the departments might say that, it looks great on paper, the actual fact is that it's not happening, and they'd really like that to happen. So the community have asked for blood testing for years now, and this was offered to other non-Aboriginal, might I say, communities such as Williamstown. So why is Wreck Bay not getting the same service as others have?
So I understand that the previous blood testing was related to a study we commissioned from the ANU to look at specific kind of bases, and I think they picked 3 bases to look at as sites of historical contamination. I'm not sure why they picked those 3 sites, but that was part of their study. So where they were looking at whether there was any correlation between elevated PFAS levels for those local communities and particular diseases. I understand they didn't find any to a level that they thought that there was a clear cause between those PFAS chemicals and a particular disease for those 3 specific communities. But why they picked those 3 specific communities, I think that predates me, and I'm not sure why those were chosen as part of the study.
I mean, I can say I have my thoughts about why 3 discrete non-Aboriginal communities were chosen to have blood tests and a one and only black community wasn't, but we won't go there today. A GP who worked in Wreck Bay for some years suggested at a start that the whole community receive health screening for cancers, cholesterol and other disorders related to PFAS exposure, and they receive this 10 years earlier than normally recommended. Do you have any idea what it would cost to provide this screening to a community of around 60 households?
I don't know what that would cost off the top of my head, but obviously I can take it on notice. There's obviously questions that come up with the committee with whether you would provide a medical kind of benefit for blood testing. That would be a question for the Medical Services Advisory Committee to advise whether that would be something that you would put on the Medicare kind of schedule. But I can take on specifics, your question, how much would that cost? And come back to you, Senator.
I'm sure it's not much. The community are also crying out for water tanks. No one cares about this community, it seems, and I'd really appreciate if you took that on notice. It seems that government are using varying definitions of PFAS. Can you please clarify the official definition of PFAS in this country?
I don't think there's an official definition as such. As I said, we kind of tend to use a compound with a fully fluorinated methyl or methylene carbon part of a molecule. But that's a very technical chemistry-based definition. So that's probably about as best as we've kind of got in a chemical sense, but I realise that doesn't translate well to kind of general kind of communication, and there's different definitions kind of around for PFAS. But it is essentially that fluorinated methyl or methylene carbon part of a molecule which defines PFAS. But it's a broad class of chemicals, and different people have arguments around the margins about what's in and what's out.
So it must make it hard then across various government agencies to coordinate knowledge and action on PFAS, because we're hearing from different governments and departments that, you know, everyone's got their own definition of PFAS. Is there any way we can have some consistency at the federal level so we're all on the same page at least?
I'm not aware of people having... So a couple of things to note, Senator. Government agencies do work well across kind of issues on PFAS. There is kind of a general coordinated entity which Defense brings together to discuss PFAS issues, and it meets quite regularly. So we do have a conversation about PFAS and what's been done in the different portfolios and how that might work better. I'm not aware of differences between government agencies about the definition of PFAS, but that's something that I could raise with the other government departments and see if there is a differing view, and if there is, obviously come back and come up with a single consistent view. So that's something which I'll undertake to raise with my other government colleagues and make sure we have a single definition.
Thank you. Can I ask, well, what may be the reasons then for this particular definition to be used, which clearly won't allow us to tackle the challenge of PFAS where it occurs?
Sorry, Senator, can you just elaborate a bit more? How do you find that the definition frustrates that approach? Is it because it's broad, or is it...
So if there is no consistency in the definition, how can we address the challenge, I suppose? But if you're not aware of other departments or agencies that have a differing definition, then you won't know the answer to that one, I'm sure.
Yeah, I'm not aware of a difference between agencies, but certainly there's a general approach of trying to avoid exposure to PFAS where possible.
During the hearings of this committee, including today and last week, we heard stakeholder and community concerns around the department's health advice for PFAS, and that its lack of clear acknowledgement with a range of health effects, lack of subsequent action to minimise exposure is not in line with international scientific knowledge or best practice. So obviously thereby putting people's health at risk. Other countries are way ahead of us when it comes to scientific findings on PFAS. Why do we not accept these findings?
So there's a few statements to unpick in there. In terms of the acknowledgement of the health effects, I mean, we do acknowledge associations between different PFAS chemicals and other effects, which we've kind of covered already in the hearing, and there is kind of within the N-Health guidance. So certainly we acknowledge those associations, and if there's ones that people think we're missing from that guidance, we're, as I said, updating the guidance, so happy to take that on board. In terms of the international perspective, generally from what I've seen, we're probably in the middle of the range, certainly for that water guidance, other than the US, which is probably the outlier for most other countries. We are generally within the ballpark of where other countries are. And so I would think that we would sit somewhere within the middle range for countries, but it would depend on what aspect you're looking at. I note that the ICAM's scheduling will phase out the main types of PFAS, PFOA, PFOS, and the other one I mentioned from 1st of July, I think, from memory. So it is being phased out within Australia. Those chemicals are being phased out and have been phased down over time, and further work is kind of underway to reduce the level of exposure to the people, exposure by people to those chemicals within Australia.
There's thousands of them. Thousands, there's a whole family of them, and whilst we might be phasing out 1, 2 or 3, there's more popping up. So,
but those 1, 2 and 3 are the ones that come through within the population that we're seeing the levels of exposure. If you have a look at the others, it quite rapidly drops off in terms of population level exposure. So we're not seeing the same levels of exposure or the same evidence on for the other PFAS chemicals. If we did, then obviously we would focus more intensely on those different types of chemicals, but it's mostly those first 3 show up quite high in the ABS stats across the general population, and those are the ones, certainly the PFOS and PFOA are the ones showing up most in terms of the association. So those are the ones we're most concerned about. But should there be other chemicals or PFAS chemicals that show up or cause concern, we'll definitely look at those. And we have heard a few others during the committee's hearing, which we'll obviously look at as well.
With the previous witness, it was said, not to use non-stick fry pans. Why aren't we telling everyone in this country not to use a non-stick fry pan because it's going to harm their health? Like, why?
As I said, those chemicals are being phased out from the 1st of July. So if they are still being put in products, like, they won't be able to anymore. But most companies have phased down, and you'll show that it shows in the ABS data that over time, like, the levels are going down because people are realising that these chemicals cause concern and phasing them out of their products. So, so if there were any fry pans left that still were using those chemicals, they've got a couple of weeks left to stop that before there's a complete ban on them being able to import them. So, so I'd be surprised if those chemicals are still going into fry pans, and if not, there'll be a ban on them shortly, which will stop them coming in.
So why don't we? Why are we not telling people now not to use non-stick fry pans? I mean, I said to the last witness, I threw all of mine out. We're in a cost of living crisis. It's very expensive to buy a fry pan. that doesn't have PFAS in it, and we've got families cooking dinner every night for their children and their sick relatives, serving up PFAS on their plates. Is the health department going to put something out to tell people not to use it anymore? I get that the company are phasing it out, but if you go down to your $2 shop in a cost of living crisis and buy a fry pan, then I'm sure that's going to have PFAS in it. So how does the health department tell everyone in this country that they should not be using PFAS-coated fry pans,
Go and buy them on sale.
and that we will subsidise or we will help you to buy a fry pan or educate you on which fry pans are the best? Like, is that going to happen? Because this is not okay.
Well, like I said, Senator, I'd be surprised if any companies are still using PFAS in their...
Yeah, but what if the use... I understand exactly what you've said, but
Sorry,
now that
Senator,
the ban's
that's my
in
line of
place, what
questioning.
happens if people go and buy them on sale?
I'm talking about the families
importers
that are using the fry
selling
pans
them off
now. Sorry, Senator.
No.
The families that are using the fry pans right now and the air fryers, what information does the Department of Health provide to everyone out there using PFAS-coated fry pans already now and their air fryers? Everyone loves their air fryers full of PFAS. Why isn't the health department telling people that they are a risk to their health?
I'm not aware what information is currently provided with air fryers or fry pans or other particular commercial products. I'd have to take that on notice. I'd be surprised if there's not some general information kind of provided with those. I know for fry pans there's general advice that if the fry pan is breaking down and the substances are coming off, you should throw them all away. I know there's general advice to that effect, but I have to take on notice the specific advice provided for specific commercial products like fry pans or air fryers.
What about makeup? Is the health department telling every person out there that wears makeup every day, are they telling the teenagers out there that are putting makeup on their face, are they telling them that that is hazardous because it contains PFAS?
Like I said, Senator, there's general evidence about association between PFAS and specific associations, but there is not kind of like a lot of evidence on the causation. But again, coming back to specific commercial products, I'd have to take on notice what advice is provided with those particular products.
Does the health department... I mean, I can name so many products right now. I could probably use the rest of the day to name the products like food packaging and the leakage of PFAS into the food packaging. And everyone, we see in the supermarkets, your apples are wrapped in plastic. PFAS, plastic. Like, does the health department have a duty of care to tell people that there are possible impacts of those customers buying plastic-coated food using makeup with PFAS? We know in New Zealand they don't have PFAS in their makeup. They got rid of it for that reason, that it causes health impacts. So is the Australian Health Department going to put a list together that can inform everyone in this country of the possible impacts on their health related to a number of products?
Specifically on the question of food packaging and food, I know FSANZ has looked at that and their view was that the level within the packaging and the food wasn't significant enough to cause a health concern. I suspect it's a similar process with the cosmetics and the air fryers and the fry pans, but I just don't know off the top of my head and hence the taken on notice. But I know FSANZ has looked at the food packaging and food and their view was that the levels were so low that they shouldn't cause some concern. Again, I suspect it's similar with the other commercial products, but I'd have to take it on notice because I'm not au fait with the specifics for particular types of cosmetics or air fryers.
We've also heard evidence that it's accumulation of PFAS in your blood. So a little bit of plastic packaging, a little bit of cosmetic, a little bit of air frying, a little bit of fry pan, food cooking, isn't that accumulating the PFAS in your blood?
Sure, and that ABS study goes to what levels are found in people's blood, and generally that was about generally below 1 nanogram per milliliter from the top of my head, which is not enough to cause any discernible level of risk to people. So that's a very low level of PFAS within a blood supply, and so shouldn't cause concern, and that is bioaccumulated over time. So obviously that's a person's lifetime exposure to PFAS.
Well, people don't even know how much PFAS they are being subjected to because we have a health department that doesn't tell them, and guidelines that aren't clear to the everyday person buying their next air fryer or their next fry pan or their cosmetic. And we've heard evidence that there is no safe level of PFAS. No safe level.
So within environmental health, generally, you can't reduce things to zero risk. Any air I breathe will have things that cause me risk in it. Any being in this room will have exposure to substances which have risks. So it's not possible to reduce things to zero risk. What you would generally do is look at the particular product or thing being consumed and then work out what's an acceptable level or what's a safe level. So, for example, NHMRC would look at water, FSANZ would look at food, ACRES would look at chemicals kind of generally, and so the different agencies would use their specialised expertise to look at what's an acceptable safe level. But in environmental health, you can't get to a zero level. There'll be radon in this room, there'll be things coming off the carpet and off the wood, and so there'll be some level of environmental exposure, whatever you do. It's not possible for people to get to zero risk for environmental health variables. And so we do work to what's an acceptable level of risk. So providing the information to the general public, isn't that something that we should be doing as a matter of our duty of care to keep people safe, to ensure that the levels do stay low? I mean, I'm only learning about every PFAS contamination through this inquiry. No one, hardly anyone knows about PFAS out there in the general population. It's in activewear. It's in high class name brands of activewear. And I'm sure, if we started naming some of these companies, that they'd go broke. But surely we can be doing something to educate families and customers to what they're getting into, literally. I mean, we do provide general levels of guidance through NHealth, and we do publish that out there. And I would expect that there'd be product-specific kind of information kind of out there as well, where there are significant kind of risks. But for specific products, I'd have to really take it on notice because it would vary by the product, I imagine, and the level of exposure you would be expected to be exposed to over the course of the lifetime of a product.
There are also companies that have stopped using PFAS in their production, so good on those big companies for doing that. Why is Australia not ratifying the listing of PFAS, PFOA and PFXH under the Stockholm Convention?
So that'd be formally a matter for DQ, but I understand generally before you ratify a treaty, you want to have the legislation in place and preferably up and operational before you ratify a convention. So that ICHEM standard that's coming in will phase those chemicals out and ban their import, export and manufacture. So I think once that's probably in place, that would probably provide the level of comfort to enable the Q to consider ratifying that convention, but it is formally a question for them, but that would be my speculation, having worked with treaties a lot in the past, that they'd want to have their legislation in place and operational before they ratified that convention.
Australian regulatory agencies like NHMRC, AICIS or APVMA, and sorry to those listening for all the acronyms, are reluctant to apply modern systematic review methodologies in the assessment of chemicals and have not fully adopted findings from studies using these methodologies overseas, like the US EPA. Why are we failing to use the gold standard methodologies when it comes to assessing chemicals like PFAS?
Thank you, Senator. I'm not sure they're not. I'm certainly kind of familiar with the NHMRC study, and that's a very thorough study of the water levels and PFAS chemicals. And so I'm not sure what the allegation is about why those aren't specifically best practice or the others, but I do know that's been a really extensive study and has involved a lot of expert consideration and witness. I know that they've looked at the most recent ARC kind of evidence. I know that they've had a range of experts providing them with assistance. So I'd be surprised if it's not meeting international best practice. In fact, I'd be fairly confident it is, but I'm not sure of the specifics of the allegation of why it is that we're not seen to be meeting best practice there, but obviously happy to consider things on notice.
Thank you. Well, we're seeing a long chain of PFAS chemicals out there, and we know that 3M was in the Parliament when this Senate inquiry was announced, and we know that 3M's response is, we're phasing it out, we're not making that chemical anymore, but we know that there are thousands of family members of this chemical that are just as bad as the ones that we say we're phasing out. So the gold standard methodology that the US are using, because they've been through the process, would be great to be used and looked at from our perspective. What responsibility do governments have to protect the public, particularly children, from involuntarily exposure to toxic substances like PFAS? And how adequately do you think this duty of care has been discharged to date?
We are advising people to minimise their exposure to those chemicals. It is hard to limit your exposure to PFAS chemicals given how widely they've been used within the Australian context historically, which just means that they're a background environmental factor. But certainly there's a lot of actions underway within government to phase them out and phase them down. I've already talked about the ICHEMs. I know you've heard evidence from both infrastructure and defence about not using them within firefighting foams as well. So there is a definite phasing down of those chemicals, and it does reflect in the ABS stats as well within the general population that those levels are coming down over time. But it is historically hard to eliminate them entirely from the environment given their widespread use in the past.
I've just got, I could go on all day. I just want to check in, Senator Pratt.
I think there's a lot still.
Well, we've got 7 minutes, so how about we halve that each?
Okay.
We're also happy to take further ones on notice. So should you have further questions, we're happy to take them. And if there's areas you think we should do further work on, happy to take those considerations. And we know you'll make a range of recommendations, which we'll also be really interested in reading as well. So if you don't get to it today, feel free to send it to us as well.
Thank you.
Thank you.
I'm interested in getting a clear sense of what standards are being used for assessing the extent of PFAS contamination and how it's measured. You said, as far as you know, it's the same definition across all agencies. And does that include the states? And is that something that the Commonwealth would know the answer to?
We do work closely with the states. Again, I'm not aware of a difference in definition between the states, but that's something which I could raise at the next NHealth meeting and see whether there is a material definition difference in the definitions.
So I'd be interested in comparing, for example, what constituents have said to us in making submissions about this is the level of contamination found that was reported when they were assessed, so that we can see how different sources of contamination are measured and labelled, and actually see what different communities have said to us where that fits in, to see if anyone is, how quickly someone is, if they've been told to stop using the water or whatever. Like, I can see that what they're being told fits within the current advice. For example, I'd also be concerned about people who are told of contamination, and when agencies knew about it for a long time, and as a result people have continued to consume those sources. So anything around those obligations as well, and of course they're interrelated as well.
So is the concern that there's different guidance being given to different communities that doesn't reflect the PFAS levels in the community, or just there's different advice being given?
I want to see how the advice that they've been given fits how you think, how governments measure it. So that we can then also look at the international measurements and where that fits with this, what we're being asked for in future research. Thank you.
Senator.
Thank you, Chair.
Thank you, Senator Pratt. I just have 2 questions and I'll put the rest on notice. And this is around blood donations. Do you recognise blood or plasma donations as viable means to reduce PFAS blood levels and potential long-term negative impacts?
We had seen the studies, and I think one of your witnesses earlier today talked about using blood donations to reduce their levels of PFAS. I'm not a medical expert on that particular study, but that seemed to be an effective way of reducing PFAS. But I know they recommended further clinical kind of assessment of that. Whether that's something which would make it onto the medical benefits scheme would be a question for the Medical Services Advisory Committee to consider based on the clinical evidence. But I'd certainly seen that, and we are aware of those studies to reduce PFAS levels by blood donations.
Great, thank you. And is the department considering it as appropriate blood or plasma given by people with the right Is the department considering it as appropriate blood or plasma given by people with high PFAS serum levels is donated to others?
I think the representative from the Red Cross talked about blood donations and their need for blood donations and how they deal with that, and I don't have anything to add further to their evidence, and I would defer to them on the blood donations.
Okay, Mr. Bouwhuis, we've been grilled for an hour, so thank you. It's a long time, and really appreciate your time.
Well, thank you for the opportunity to appear, and thank you for the hearing and the process. And we are really interested in the results and recommendations you come up with, and so we do look forward to reading those. Thank you very much.
There's also a lot in the evidence we've already heard that's worth reviewing. The department,
Thank you. Thank you very much.
That's fantastic. So thank you for your time. If you have undertaken to provide additional material on notice, please provide it to the Secretariat as soon as possible and no later than 5 p.m. Monday, 30 June 2025.
Great. Thank you very much. Thank you.
Thank you.
I now welcome